enough is enough, so says the head of internal medicine at Charlotte Maxeke Hospital, Professor Adam Mahomed. Well, he believes there's no accountability from the Gauteng Health Department for the hospital's ongoing struggles. He spoke to eNCA about the state of the Gauteng healthcare system.
It's just shocking up to date. I have not seen any positive things, contrary to all the media briefings that happened last week. I am still not convinced that we are moving in a positive direction. We talk about stuff being stolen from the hospital. It's happening every weekend, and we know this for the last year, yet nothing has happened. Our CT scanners are still not working. There's still issues of tenders and which tenders you use. There's just no accountability and responsibility. There's not a single person that has been taken to task. Those 3 healthcare workers or procurement officers from Charlotte Maxeke, they just little tip of the iceberg. We're talking about not millions anymore, 100 millions. We're talking about billions that are being stolen from patients. And to date, there's not one official that has put up his hand and said, I take accountability. If something happens in my department, I should be the first person to be fired because I'm responsible. You tell me where that is happening in the healthcare system, in Gauteng, and in the national department. It's not just Gauteng. It's across the country. And enough is enough.
Now, the Gauteng Health Department is dysfunctional and doesn't serve the interests of the public, and that's according to health expert Dr. Kgosi Letlape. He believes healthcare should not be the responsibility of provinces.
I think clearly what this shows is that there's a crisis in Gauteng, if not just in general, in most of our provinces. If you look at the fact that Gauteng had promised that they would fix Charlotte Maxeke by 2027, with intervention from national, it's been brought down to December 2023. It's about time we accept that provincialization of health doesn't work and that health has to be a national competence. That would also shorten the line of accountability. You wouldn't have low-lying officers or MECs or provincial systems. The Minister of Health, the National Minister of Health, would take accountability. The Director General of Health would take accountability for operational matters. We need to accept that the Gauteng Department of Health is dysfunctional and does not serve the interests of the public. And we need urgent action for it to be put under administration.